Like so many Canadian hospitals, this one, north of Toronto, is filled with patients battling all kinds of respiratory viruses. 4-year-old Wolfgang is one of the youngest. On this day, he's being treated for his third bout of pneumonia since September.
And we've spent so much time in hospital with him, but it's hard to see your little guy struggle.
Wolfgang has severe asthma, putting him at risk of serious illness anytime he catches a respiratory infection. This year, it's been hard to avoid.
The ER nurse that came with us in the ambulance ride down telling us how lucky we were to even get a bed here because the crisis is so severe right now.
Yeah.
The pediatric team here at Markham Stouffville Hospital told us their unit is overflowing.
I've got 3 extra shifts this week to help deal with the increased numbers.
The team's funding is for 5 beds. Instead, they're caring for a dozen or more children every day.
We are ready for a 300% plus capacity here, but if we do want to go any higher than that, we do have to start creeping into some of our adult spaces, which we are prepared to do so.
But using adult beds for kids could prove tricky.
It's actually very difficult.
The hospital's infection control lead projects at least 20% more adult admissions than a typical flu season.
Our real concern is the severity of illness that we're seeing in the kids, and we're expecting to see more adult cases. Usually they come 2 to 3 weeks after the kids' cases start to peak.
The hospital is already at its limit. A major surge in adult patients would force the team to add more beds. No easy task after years of staff shortages.
Just did a chest x-ray. We're just waiting for his results.
The hospital's newly opened respiratory virus clinic is one way they're trying to keep sick community members from needing a bed in the first place. This space used to be a COVID-19 assessment center.
It's much better than actually.
Medical Director Dr. Christina Popa says it's meant to take pressure off the emergency department.
We have individual rooms that the patients can get the actual privacy.
So they're automatically isolated.
They are automatically isolated.
There are no easy answers for how Canadian hospitals will get through the next few months. Staff here are just trying to stay afloat while helping patients like Wolfgang get better so they can get back home.
So I should note, since we visited the hospital, Wolfgang has actually come back home and he's now recovering with his parents.
Okay, so there's some good news. I'm imagining Canadians at home looking at this and saying, I don't want to end up in hospital and I don't want my little ones to end up in hospital. So what are the takeaways here?
Well, some of these above average projections for flu admissions are tied to Canada's fairly low vaccination rate. For seniors who are at a high risk of influenza, they actually only have around a 70% vaccination rate in recent years. That's 10% lower than the federal government's targets. So the physicians that we spoke to said, get your flu shot. Everyone in Canada over the age of 6 months old is eligible.
All right, Lauren Pelly, Senior Health and Medical Reporter, thank you.